Imagine there is a silent enemy living inside your body, heart disease. It doesn't declare war with loud warning signs, but quietly erodes your blood vessels, silently planting the seeds for tragedies like heart attacks or strokes. The most dangerous thing? Before it strikes, it always sends warning signals, but they're so subtle that most people overlook them. This article will help you become a health detective, capable of identifying this hidden enemy from the very first warning signs. Ready to uncover the truth? The fact is, the early signs of heart disease are often not what you see in movies. It's not always a dramatic chest pain or collapsing on the street. Instead, it can begin very quietly. Prolonged fatigue, unusual indigestion, or sleepless nights for no clear reason. Many people experience these symptoms but dismiss them. In this article, we will work together to identify the early symptoms of a heart attack, the warning signals your body has been sending you. At the same time, you will learn essential steps on how to prevent a heart attack, protect your heart, the most important asset of your health, and aim for a healthier, more proactive life. These are the signs and symptoms your body may use to warn you weeks or even months before a heart attack occurs. Recognizing them early is the first step toward effective prevention. Unusual, prolonged fatigue. Symptom: this is not the typical tiredness after a regular workday. You feel extreme exhaustion, even without engaging in much physical activity. Even after resting or getting enough sleep, the fatigue does not improve. Explanation: when arteries narrow due to plaque buildup, one of the main causes of heart attack, your heart has to work harder to pump blood. This process drains your body's energy, leading to prolonged fatigue. Data: according to research by the U.S. National Institutes of Health, NIH, over 70% of women who experienced a heart attack reported suffering from prolonged fatigue beforehand. This is an early sign of heart disease that many people often ignore. Self-check. Have you recently felt fatigued to the point where it affects your daily activities, such as walking or doing housework? Sign number 2. Shortness of breath with mild exertion or even at rest. Symptom: you feel breathless or have shallow breathing while doing simple tasks like walking around the house, climbing a few stairs, or even while sitting still. Explanation: when your heart is not functioning efficiently, blood may back up into the lungs, increasing pressure and causing some fluid to leak into the lung tissue. This interferes with oxygen exchange, leading to shortness of breath. Data: this could be a symptom of an impending heart attack or a sign of heart failure. If you experience this symptom, you should get a health check as soon as possible. Self-check: have you noticed that you've been getting short of breath more easily while doing activities that used to feel normal, that previously you could do without any issues? Sign number 3. Sleep disorders. Symptom: you have difficulty falling asleep, often wake up in the middle of the night for no apparent reason. Some people even wake up feeling anxious with a racing heartbeat or shortness of breath. Explanation: when your heart is experiencing problems, especially during the pre-heart attack phase, your sympathetic nervous system can become constantly activated. This system controls the fight or flight response, putting your body in a constant state of tension, making it difficult to fully relax. As a result, your sleep is disrupted, making it hard to achieve deep, restorative rest. Data: prolonged poor sleep quality is not only a consequence, but also an early warning sign of an increased risk of heart attack. Studies have shown that insomnia is directly linked to severe cardiovascular disorders. Self-check: have you recently experienced disrupted sleep without clear reasons, such as stress, caffeine consumption, or other external factors? Sign number 4. Discomfort in the upper abdomen or indigestion-like sensation. Symptom: You feel a dull ache, burning sensation, bloating, or pressure in the area just below the breastbone, upper abdomen. Many people easily mistake this for ordinary bloating or common stomach discomfort. Explanation: this is known as referred pain. The heart and stomach are located close to each other and share certain sensory nerves. When the heart is having issues, especially during the phase leading up to a heart attack, the pain signals may be misinterpreted by the brain as coming from the stomach. Data: a characteristic point to help you distinguish this. The pain or discomfort often becomes more noticeable when you engage in physical activities like brisk walking or heavy work, and tends to subside when you rest. This is one of the atypical symptoms of a heart attack, but should not be overlooked. Self-check: have you noticed indigestion or upper abdominal discomfort occurring more often during activity and easing when you sit down to rest? Proactively building trust in healthcare. It is crucial to find a trustworthy doctor, someone who is willing to listen and does not rely solely on test results. However, you also need to become an overall observer of your own health. This means understanding your body well and monitoring even the smallest lifestyle changes or symptoms. Many people have shared that their concerns were dismissed or even misdiagnosed as other conditions, such as anxiety or acid reflux. To avoid such situations, you need to take a proactive role. Be a companion to your doctor, not just a passive patient. How to prepare for a medical checkup: the 3C method. 1. Be concrete. The clearer your information, the easier it is for the doctor to make an accurate assessment. What to do? Before your appointment, note down the following details. What are the symptoms? Example: chest tightness, shortness of breath, radiating pain to the jaw or shoulders. When do they occur? While walking, after eating, during sleep. How long do they last? 5 minutes, 30 minutes, all day. Severity: rate on a scale from 1 to 10. What factors worsen or relieve the symptoms? Worse with activity, better with rest. Why it matters. Detailed information helps the doctor accurately visualize your condition, reducing the risk of missing early warning signs of a heart attack. 2. Be credible. Highlight risk factors and objective information to increase your credibility. What to do? Provide family medical history. For example, my father had a heart attack at age 50, so I'm very cautious about these symptoms. Bring a family member along. They can confirm the changes you've experienced. For instance, I've noticed my wife has been getting short of breath while walking, which never happened before. Why it matters. Providing well-founded information shows that your concerns are not general anxiety, but have legitimate grounds for a thorough health evaluation. 3. Be curious and assertive. Don't just listen passively to the doctor's conclusions. Ask questions and suggest appropriate tests. What to do? Ask polite but clear questions, such as, "If we can rule out heart-related causes, I'll feel more at ease. Could you order additional tests for me? Could I have a troponin test or an echocardiogram to check more thoroughly?" Why it matters. A proactive attitude helps you become someone who understands your body and takes responsibility for your health. This approach can lead to early detection of risks and help you avoid long-term treatment, such as using medication for patients after a heart attack, myocardial infarction drug treatment. The most important part is this: how to avoid a heart attack. The answer does not lie in medication or quick fixes, but in building a comprehensive, long-term preventive lifestyle. This is the simplest and most effective way to reduce your risk of a heart attack while improving your overall health. Imagine your lifestyle as a solid protective system for your heart. Below are 4 foundational pillars to help you build that system. Pillar number 1. Proper nutrition for a healthy heart. What you eat daily can either support or harm your heart. A proper diet is the first step toward preventing heart attacks. Key principles to remember: prioritize natural, minimally processed foods, vegetables, fruits, whole grains, legumes, and nuts. These foods are rich in fiber and antioxidants that help protect your blood vessels. Add healthy fats. Choose olive oil, avocados, nuts, and omega-3 rich fish like salmon or sardines. Research shows that omega-3 helps reduce inflammation and protects the heart. Limit harmful fats and sugar. Drastically reduce saturated fats, trans fats, refined sugars, and salt. These are major factors contributing to high blood pressure and heart problems. Easy application tips. Replace one unhealthy snack per day, such as sweets or chips, with fruits or nuts like almonds or cashews. Apply the colorful plate rule. Add a variety of colorful vegetables to every meal to ensure your body receives all essential nutrients. Pillar number 2, regular physical activity. Physical activity boosts heart health and reduces the risk of heart attacks. Key principles to remember. According to the American Heart Association, you should engage in at least 150 minutes per week of moderate intensive exercise, such as brisk walking or light cycling, or 75 minutes per week of high-intensive exercise, such as running or swimming. Combine cardio exercises with strength training to maximize benefits. Easy application tips. Choose activities you enjoy. Walking, cycling, yoga, dancing, or gardening are all beneficial for your heart. Start with small habits. If you're not used to exercising, begin with 10 to 15 minutes of walking daily and gradually increase your time. You can also break it into smaller sessions, for example, 3 10-minute walks throughout the day. In summary, preventing a heart attack is not difficult if you actively build healthy eating habits and maintain suitable physical activity. These two foundational factors are easy to implement and deliver significant benefits for protecting your heart. Pillar number 3, managing stress and mental health. Mental health has a direct impact on heart health. Chronic stress is one of the factors that increases the risk of heart attacks. Key principles to remember. When you are stressed, your body releases hormones such as cortisol and adrenaline. These hormones cause your heart rate to increase, elevate blood pressure, and raise inflammation levels in the body, especially in the blood vessel walls. Reducing stress is an essential part of maintaining long-term health and preventing heart attacks. Practical suggestions. Practice deep breathing or meditation for 5 to 10 minutes daily. Simple method. Inhale through your nose, count to 4. Hold your breath, count to 4. Exhale slowly through your mouth, count to 6. Repeat several times. Spend time outdoors, go through a walk, or talk with family and friends. Social interaction and connecting with nature are effective ways to reduce stress. Pillar number 4, getting enough sleep and improving sleep quality. Sleep is the period when your body repairs itself, especially the cardiovascular system. Key principles to remember. During sleep, your blood pressure and heart rate naturally decrease, giving your cardiovascular system time to rest. If you do not get enough sleep or have poor sleep quality, your risk of high blood pressure and heart attacks increases. You should aim to get 7 to 9 hours of sleep per night to maintain heart health. Practical suggestions. Avoid using electronic devices for at least 1 hour before bedtime. Blue light from phones or computers can interfere with melatonin production, the hormone that supports sleep. Optimize your sleeping environment. Keep the room dark, quiet, and cool. Use a suitable mattress and pillows to enhance comfort. Summary. Building the 4 pillars of nutrition, physical activity, mental well-being, and sleep is a process that requires time and persistence. Every small positive change contributes to reducing the risk of heart attacks and helps you maintain long-term, sustainable health for the future. We have just walked through some essential topics together, from recognizing the early signs and symptoms of a heart attack to proactively working with your doctor and building an effective prevention plan. Now you are no longer just an outside observer. You have the knowledge to identify the symptoms of a heart attack and understand the necessary steps to reduce your risk of heart disease. Knowledge is the foundation that empowers you to take better care of your health. It helps you listen to your body, communicate clearly with your doctor, and gradually adjust your lifestyle to prevent heart attacks. Health depends on real action. The information in this article only becomes valuable when you apply it to your life and share it with others. Small actions can make a big difference. They might even save someone's life. We urge you to take these 2 actions right now. Share this article. Send this article to your family, friends, and colleagues. A single share might help someone recognize dangerous warning signs they've never noticed before, or motivate them to care more about their heart health. 2. Leave a comment below. Share your thoughts or personal experiences. Which sign surprised you the most? What will you start doing to protect your heart? Examples: I will spend 15 minutes walking every day. I will replace junk food with fruits and nuts. Every comment, every share contributes to building a healthier, more conscious community when it comes to heart disease prevention. Remember, your heart works tirelessly, second by second, minute by minute, to keep you alive and healthy. What you need to do is give it the attention, care, and proper protection it deserves. Because you deserve good health and a better quality of life.